Good morning, everyone. Welcome to my prep hour. My name is Catherine Lewis, and I'm joining you today from Brisbane in Australia. So, welcome and good morning. I hope today that I can help you with your OET preparation for the upcoming exam. So I'm hoping today that I can assist you with your speaking. So good morning. I can see a lot of you joining already. Problem with my audio. Just let me correct that for you. Let's see what we can do here. All right, let's take a look at, can everyone hear me now? Good morning. I think I've got an audio problem. How is it going now? Are you able to hear me? Let me just check my settings here. Oh, okay. Oh, in YouTube, you can hear me. Okay. All right, let's continue with that. Okay, sorry about that, folks. Maybe we'll start with the lesson. If you can let me know where you are. You can hear. Okay. Welcome, everyone. If you could please let me know whereabouts you are in the world and what time it is. I'm in Brisbane here in Australia. It's a beautiful spring morning and the time here is just past 8 o'clock. All right. So I I hope everyone can hear me. I'm sorry if you are having difficulties there. I might share let's take a look at the lesson for today anyway. 1 a.m. in Saudi Arabia. Thanks, Kristen. You're getting up very early, or you're staying up late to join us. Perhaps you've just finished work. 11:10 p.m. Rayhan, you're in Glasgow in Scotland. 3:30 a.m. in India. Wow, that's certainly an early start for you. Fatima, 11 p.m. in the UK. Fantastic. Well, you're very dedicated, and thank you. Thank you so much for, taking the time to join. That's wonderful. Certainly is wonderful, isn't it? Great to have so many of you joining today. That's brilliant. Okay. All right. So as I said, I'm just going to share my PowerPoint with you. Here we go. So today's lesson. So if you're joining on Facebook or perhaps on YouTube, don't forget to subscribe to OET Online. I am one of the tutors from OET Online, and I really hope that you get lots of tips today about how to prepare really well for your upcoming OET exam. So I'm not sure if your exams may be coming up in a couple of weeks' time, or maybe you're not going to be doing your exam until a few months' time. Either way, it doesn't matter. So we can certainly try and give you some, we'll give you some help along the way. Oh, my webcam seems to have frozen. So just let me change my camera over. Hopefully you can see me now. What's happening to my video this morning? No. Let's start my video up again. Doesn't seem to want to show my video. There we go. I think that's working now. Oh, start video. Goodness. Having a few problems today. Apologies there. Let's try and get this going with a different video now. Oh dear. We might have to do this without my video on, I'm sorry. Just doesn't seem to want to show you my video. Okay, not really sure why. Oh, let's try it in a little while anyway. My apologies there. Anyway, I'm Catherine Lewis. I'm one of the tutors from OET Online, and I'm here today to help you with speaking. And yes, we've got people from all parts of the world. We've got Adiranki from Nigeria. Hello, it's evening there for you. Okay. So in today's prep hour, these are the things that I am going to be stepping you through. We're going to use a role play topic of a medical condition, quite a common one actually, called Blepharitis. So the reason why we're going to be using this particular topic today is so I can show you some different features of the OET exam. So these are things like making sure that you're using an everyday explanation when you're speaking with your patient, using good question asking technique, being tactful. So we do that so we don't upset the patient, and using idiomatic expressions. I love idioms. I think they are fantastic to use. It's a really good way, I think, of building a relationship with your patient, because it shows them that you're using the same language as them. It's quite a friendly thing to do, and we'll be taking a look at that as well today. So let's just quickly take a look at the different parts of the, we're going to look through the assessment criteria now. So the first things that we'll talk about are the linguistic criteria. So these are things like making sure that you are speaking so that your patient can understand you. And you're also going to be making sure that you're fluent. So it doesn't have to be as fast as a native speaker. I find that a lot of the time, look, students really, I think they do worry about their fluency, but you don't have to speak too fast, not too slow, just right. It's not so much about speaking really, really fast with zero pauses. No, it's about when you do pause and when you're searching for words, try not to fill those gaps with fillers. So that's things like and I guess we do that because it's a sound that we make while we're thinking. So it makes it really difficult for the listener to understand what you're saying if you do that. So we're just going to make sure that when you are, in fact, when you are using your language, that you're trying to speak clearly. Now, the things I'm going to focus on today are things like using appropriate language. So what does that mean? That means that you're going to be speaking professionally, and you're going to try not to use words that are too technical for your patient to understand. So it's really important that you can speak in a way that your patient will understand you. Okay. The next thing is that you're going to use language that your patient can understand, using good grammar, and make sure that you're using a variety of vocabulary as well. Communication criteria, the clinical communication criteria. The thing that we need to do here is we're going to today practice being tactful with the relationship building side of things. Okay. We're going to understand and then use what we understand from the patient's point of view or perspective. We're going to listen to what they tell us, and then we're going to make sure that we're using that in the discussion. Okay, so that's really important. We're going to provide structure. Another thing we're focusing on today is good question asking, so gathering information and then giving information. So we're going to check what the patient already knows, and then we're going to top this up. Okay. So blepharitis. Heard of this condition? We're going to be talking about blepharitis. So can anyone tell me which part of the body is affected with blepharitis? So we're going to use the chat box to communicate. If you know the answer, pop your answer into the comments box. Eyelids, Dahlia. Thank you. So, look, it doesn't matter if you don't know which part of the body is affected, if you don't know anything about blepharitis. It's not a problem. So, the thing that I'm here to do today is I'm here to give you some confidence for the exam. So, the really good thing is that if you go into the exam and you imagine that you are the world expert, then you will be able to feel really confident with your explanations, the way you are explaining things to your patient. So for the 5 minutes of the OET exam, you are actually the world expert on this medical condition. So I guess you do want to keep in mind that your patient has come to get some help about this medical condition. In the real world, if you didn't know much about blepharitis, then you could use your knowledge, you could add to your knowledge and you could maybe look things up on the internet. But we can't do that in the OET exam. It doesn't matter though, because it's an assessment of your ability to have a conversation with your patient in English using the information on the roll card. So here we've got a picture of the eye. Blepharitis affects the eye. And we can use the word roots, the prefix and the suffix for this word to guess the meaning. So blepharo refers to the eyelid and eyelash, which a lot of you have been able to tell me about. And itis means inflammation. So what are the other parts of the eye? We've got here the eyelids and the eyelashes, but what are the other parts? Maybe you know a technical word or a simple word for other parts of the eye. So we've got things like the iris, we've got the caruncle, we've got the pupil, and we've got the sclera. So we've got all these different words for different parts of the eye. The eyebrow as well, of course. So blepharitis is inflammation of the eyelids and the eyelashes. Now we've got some pictures that are showing different eye conditions. You're giving me the names of other parts such as the cornea. Thanks, Fatima. Thanks, Nina. Excellent. So that might be useful when we need to explain different eye conditions. Which of these pictures show someone with blepharitis, do you think? So is it A, is it B, or is it C? Blepharitis, so eyelids and eyelashes mostly affected. Maybe you know the names of these other medical conditions. don't know the name, maybe have a go at describing it. I can see a lot of you showing C, and C is the correct answer. So A is conjunctivitis, commonly known as pink eye. B is a cataract. And C, of course, is blepharitis. So in this picture, if we take a good look, we can actually see that we've got inflamed eyelids and the eyelashes, and oh, we've got something else here. What do we call this? What's happening there? What else is happening in picture C? What else could you describe in picture C for this patient with blepharitis? Maybe a sticky eye, Dahlia. Yeah, so it's sticky. We can see that looks a bit like glue, doesn't it? All right. Let's go back again to the picture of the eye with all of these different names. So maybe we want to describe further what's happening with blepharitis, not just know the names of the eyelid and eyelashes. Maybe when we speak to the patient, we need to use other names to describe the parts of the eye. So some of these words the patient will know, and some of them they simply won't know. I can see that you're giving descriptions for words like edema and pus. So we want now to focus on maybe distinguishing these words, these descriptions, from words that are technical and words that are simple or everyday words that our patient will be able to understand. So let's take a look at that now. So technical words, words like sclera. Do you think any of these other words are technical? Ah, chalazion. Okay. That was something that we saw in that previous picture. So sclera is technical. Any other names of these parts of the eye that you think maybe our patient is not going to be able to understand? The caruncle is the other one. So these are the two parts our patient just might not understand. Iris, perhaps we might need another way, Dahlia, to describe that part of the eye. So we might need to think of a way to describe, for example, as Dahlia suggested, the iris. We'll come back to that in a minute. The sclera we can say is Aram, thank you, the white part of the eye. Let's skip now to the caruncle. How would we describe the caruncle? What can we do there? Thanks, Felice. Iris is the colorful part of the eye. And we can describe the location as well, like we're doing here. So, for example, the caruncle is the part of the eye. We can say it is the red part of the eye at the inner corner of your eye, the caruncle. The iris, we could say, is the colorful part of the eye. We could say it's around the pupil or the black part of the eye. So what do we need to know to explain blepharitis to your patient in the OET exam? What are we going to need? The basic 4 things we need. The first thing, we need some medical knowledge. This is really important. We need medical knowledge, but only some. So if we don't know everything about blepharitis, we can still do well in this exam. It's testing your ability to communicate to the patient about the condition in English. So some medical knowledge. We need an OET Roleplay Card. Of course, that's essential, isn't it? We must have this to be able to do the exam, of course. And vocabulary knowledge. So this is an absolute. So what is it about the vocabulary knowledge that we need? What specific type do we need? So we need some technical word knowledge and we need some everyday words as well. We just can't get by in this exam without some vocabulary knowledge. Okay. So it's really great if we know both sets of words. It might be something that you need to work on, maybe, get some practice thinking about, oh, okay, there's 2 types of words here, not just maybe I can't get by just knowing one of these words, one of these ways to describe the body part. So maybe on this slide, on this picture of blepharitis, there are some descriptions. You might be familiar with the technical words. Maybe that's what you think of from your reading that you do for your profession, from the textbooks that you have read in English to learn about things at university, perhaps even. So we really, it's necessary to be able to explain things to the patient in simple language, isn't it? So maybe you've got this diagram of blepharitis in your mind when you think about the condition. Some of these words mean then? Meibomian glands, how would you explain that to your patient? Or how would you explain words like debris? Are you familiar with flaky and crusty to describe the adjectives to describe here? What do those words mean? So you're going to, oh, I've left one thing out. There is one more thing that we need to be able to communicate well with our patient and do the OET exam. We need the clinical communication skills. So blepharitis, maybe you think of this textbook definition when you think about it. So blepharitis is usually bilateral, occurring along the margins of the eyelids. It commonly occurs when meibomian glands near the base of the eyelashes become clogged, causing irritation and redness. Can I use this textbook description when I'm speaking to my patient? What do you think? Well, you could. These are perhaps going to be the words that are on your roll card, but it's best to explain what these technical words mean. Do you think you could explain this textbook definition in simple everyday language to your patient? How confident do you feel doing that? Are you using appropriate language when you do your role plays? So we're going to explain it further. So the next thing that we're going to do is look at converting or translating from that textbook definition into an everyday explanation for our patient. So I've given you some suggestions for how to do this. I've translated it. Now, you don't have to 100% avoid using those technical words. We don't have to do that. What we can do is we can use the technical word and the everyday words in our sentences. So for example, blepharitis is usually bilateral, meaning it affects something along the margins. So first of all, what does bilateral mean? It's usually bilateral, meaning it affects both eyes along the margins or something of the eyelids. So the margins of the eyelids, maybe people don't understand this very well. So the margins or the edges of the eyelids. It commonly occurs when something known as by meibomian glands. So what's another way that we can say meibomian glands? How would we describe that? We could say tiny oil glands known as meibomian glands. You may have photophobia. So this is for people with blepharitis, which means your eyes are, whoops, I've missed out one. Sorry, let's go back. The glands are near the something of the eyelashes, the base, and photophobia means your eyes are sensitive to light. Okay. Well done. I can see some of you are able to convert these words. You've got the vocabulary to be able to say it both ways. So we can think of vocabulary as two different parts of, split into two parts. So when we're thinking about this vocabulary in a medical context, explaining things to our patient, we're splitting our language up into two columns, if you like. On one side, we've got the medical or technical words, and on the other side, we've got the everyday language. So what does the technical mean? Well, the technical words are the way you might think about it in your mind. If you've been reading medical textbooks in English, professional journals in English, that's the way you think about it. It's also how you communicate with your colleagues in listening part B, in the referral letter, in the writing. And the way that you would maybe describe it if you were doing an exam at university or for your profession, using your medical knowledge. But what about the everyday language? What's that? Well, they're the phrases, the words that everyone can understand. So you've got plain language or simple words. Plain English, we sometimes call it. Phrasal verbs, for example, block up, get clogged, block up. The common phrases, for example, step by step. Idiomatic expressions, for example, in a nutshell, things like that don't have a literal meaning. It could be found in newspaper articles. There's also a lot of websites, consumer information, information for patients. And there's usually an A to Z on health conditions on websites, such as the Mayo Clinic. You might know other ones too. So, when do you have to use everyday words? Well, we use them in the real world. So we use them when we're speaking to patients in English about their health, about their medical problems. You might want to consider that your patient, maybe you know their background, maybe you know how much education they've had. You might be able to get an idea of what kind of language they understand. Maybe they do understand some technical words about, health conditions. Even if they are well educated, have a good job, work as a professional in a different industry, a non-medical professional, perhaps they don't know all of the technical words that you know. So you can ask, have you heard of blepharitis? Just to be sure. In your OET exam, well, we assume that the patient has a low level of English. You don't have to completely avoid technical words, but you should say something like the translation we looked at on the earlier slide. You have blepharitis, which means your eyelids and eyelashes get inflamed and sore. Every time you give information, remember in your OET exam, it's a good idea to ask, have you heard of blepharitis? And then we can fill in the gaps. We can then top up your patient's knowledge. Okay, so we're going to have a look now at a role play card. It's the healthcare professional's role play card for a patient with blepharitis. Now, maybe you're a nurse or a doctor or a pharmacist or an optometrist. This might apply to you. So we've got some things we're going to focus on, for example, in our preparation time, how to begin the role play and what type of patient do we have. On this role play card, your patient thinks they have blepharitis. This is the background information. For the third time in the past year, you observe that both eyes are red with swollen eyelids that have crusting. They have been using lubricating eye drops that you recommended previously, but believe they need something stronger to help with the irritation and are frustrated that it has come back. They also have seborrheic dermatitis. You have just examined their eyes. So from that information, how would you begin? Maybe we can just focus to begin with on our the background information that we've got. So I might just for now cover up the task to focus us on the background for how to begin. And can you determine what type of patient are we looking at here, first of all? So we know that we know something about the patient to start with here. So how to begin? We're going to start from thinking about the fact that we know the patient and we have just examined their eyes. Shazad, anxious. We know this patient is frustrated, in fact. So we can we can see that our patient is frustrated in our opening our background there. And we're starting the task confirming this is blepharitis that has returned. So we have just examined their eyes. So we can start using some information that tells us that we've got some knowledge of them. Okay, so we've just looked at the eye and can confirm that, yes, you do have blepharitis that has come back again, unfortunately. It does look painful. Shazza, we could use that based on my examination, or I've just had a look at your eye. Yes, the patient knows a bit about their condition already, so we should be using that knowledge, shouldn't we? Okay, the next thing we're going to do is we're going to translate some things. We're going to explain some things for our patients. So which of the words in the task now can we translate? Well, we're going to translate something like, for example, exacerbations. Maybe you can tell me what is another way we could say exacerbations. That's a little technical. Warm compresses. So the word compresses, maybe I know what that means, but does my patient know? Can we assume that they know that? Maybe we can explain that, expand on that a little. Seborrheic dermatitis and rosacea. Thanks, Shazad. Yes, exacerbations getting worse when it flares up, perhaps. So these other medical conditions, these other possible causes might be words that we can explain. Meibomian gland dysfunction. So yes, we do know that this, as I said, the patient knows his or her condition already. Maybe they know a bit about meibomian gland dysfunction, but dysfunction, that's a little technical. Steroid preparations, we know what they are, but does our patient know what steroid preparations are? They've just asked for something stronger. So steroid preparations, we might be able to give an example there of what that is. The next thing is, how will you explore compliance to the self-care management steps? Well, it's going to be important that we are tactful because our patient is frustrated. What does tactful mean? We're also going to use a good questioning technique. So for example, we're going to go from open to closed questions, and we're also going to use some indirect questions. Can you think maybe of an open question or a closed question to use in this step, in this task, to check which of the self-care management guidelines recommended last time have been implemented? Rana, that's right. Tactful means mindful. So we're going to be sensitive to the patient's needs so as to not upset them. All right. So we know that they're frustrated about their condition. Okay, now to this vocabulary, this technical and everyday. It's a dual layer of language. We've got two separate sides here. We should split it up into the two sides whenever we're thinking about it. And it's a good idea whenever you come across new words to try to think of it this way. If you find a new word, try and find both the technical and everyday way to use it. So, for example, exacerbations, as Shahzad has already suggested, and Alreza, yes, exacerbations, some flares or flare-ups, or it means it's getting worse. So the times when it is worse. Does anyone else have maybe knowledge of a simple way to say any of these other words? Compresses, so warm compresses, here it's the noun. Dysfunction, seborrheic dermatitis, rosacea, steroid preparations. Do you know how we could say this more simply for our patient? So let's go through them one by one. Let me know if you can think of a simpler way to explain any of these. Flannel or a face cloth or a face washer is a compress. This is the actual thing that they're going to use. Function. So that means that something is not working as it is supposed to. Seborrheic dermatitis, a common skin condition that mainly affects your scalp. Rosacea. How would you describe rosacea? It's another common skin condition. It causes blushing or flushing and visible blood vessels in your face. And steroid preparations, maybe we could describe as eye drops or ointment that reduces the inflammation. Yes, this is the patient's second visit. So maybe they already know some of this information about their condition. It's been over a year that they've been having these flare-ups. So maybe you just need to still reinforce that they know the language. So using a good questioning technique, this is what I'd like to talk about next, specifically that second task. Check which of the self-care management guidelines recommended last time have been implemented. For example, 2 to 4 times daily for exacerbations, and we're going to explain what that means. Warm compresses, we can also explain what that means, or just, check that they know. Firm eyelid massage, baby shampoo, eyelid cleanse, lubricating eye drops, and you might have other ideas. So the words in brackets, you can use your own ideas, remember. So we're going to avoid using a compound question. For example, this is something that I'd like you to avoid. Let's focus perhaps first on this bottom left. So, and we'll get to that next. But first of all, avoid a compound question. For example, have you used any of these self-care management guidelines that were recommended last time? For example, 2 to 4 times daily for exacerbations, warm compresses, firm eyelid massage, baby shampoo, eyelid cleanse, or lubricating eye drops? How does your patient answer that question? It becomes very confusing. Maybe they just say yes, but what does that mean? So I think it's really important that we improve on this. There's a better way. Okay, Kristen, we could start with how have you been since I last saw you? So that's a nice open question to start with. Shahzad, yeah, too many things in one question. It's a compound question. There's a better way to find out the information we need. We could start with the open question and then proceed. So I've got some examples of a questioning technique, 1, 2, and 3. We need to put these in order. We're going to start with something open. Which one is the open question? Or which one is a good way to start this conversation? So is it 1, do you mind telling me which ones you can recall? Is it 2, is it okay if I ask which of these you have been following? I just need to check because it will help me decide what the best treatment is from here. Or is it 3, do you remember the self-care guidelines we talked about last time? It is, in fact, number 3 that we will use first. So this is the way to open the conversation. And then we're going to find out, we're going to get to which ones they're using now. Okay. See some of you putting number 2 there, that's great, as the last one. Number 3 as the first one. All right. The next thing that we're going to do is we're going to avoid using the exact words on the roll card. So for example, it is recommended that you a warm face cloth. You also need to firmly your eyelids and thoroughly them with some baby shampoo that has been mixed with water. The last thing is you should aim to this routine 2 to 4 times daily when you have a flare up. So here we can use some verbs. Verbs are going to help to change from the technical words on the role play card into a more everyday questioning technique. So the first one, apply a warm face cloth, massage your eyelids, clean them with some baby shampoo, and implement this routine 2 to 4 times daily. Okay. We're going to be tactful. We're not going to say things in a way that might upset the patient. Okay, next I'd like to get to the idiomatic expressions. So maybe you've heard of some idioms that have been used before in role plays. I mentioned one earlier, in a nutshell. So I'd like to suggest some idioms that you might use for this role play. For example, you could try under the weather, do the trick, or down the track. Now, there's a few different ways we can use these idioms. The first one, let's take a look at what they mean first of all. So the first one is under the weather, and it describes someone who is A, using an umbrella, B, unwell, or C, very busy. Which one is it? A, B, or C? One is B. Shahzad. No, yes, you are correct. One is B. Well done. Number 2, the expression that should do the trick can be used when we want to say we think something is A, magic, B, will deceive or confuse another person, or C, will achieve the desired result. Shahzad. It will do the trick. C, correct again, will achieve the desired result. Number 3, down the track refers to a time in the past, in the present, or in the future. Number 3, down the track time in the future. Okay. Next, I'd like to take a look at how we're going to actually use these in our role play. So, the best thing that we can do is have a variety of idioms ready to use in different situations. So, for example, I've chosen specific tasks here, like confirm that the blepharitis has returned. Let's focus on this part of the role play. And you have just examined their eyes and confirmed this. So we could say, I'm not surprised you are feeling a bit unwell. It is in fact blepharitis as you suspected. Then we can convert that to use one of those three idioms we just looked at. The other part of the role play is here, this task. Explain that causal treatment usually suffices and means you don't have to resort to steroid preparations. They have side effects. And this is a little technical. Causal treatment usually suffices. So another way we could say it is treating the cause generally works. We want to then convert that to using it with an idiomatic expression. So it's not a literal meaning. We're using an idiom, and we could use one of the three from the previous slide. Any ideas how we could convert these? We could say it this way, treating the cause generally works, or we could use an idiomatic expression. Any ideas what we could use? Well, treating the cause generally does the trick. Shahzad, you got it. We could then, for feeling a bit unwell, change that to feeling under the weather. But there we have two ways to use idioms. Let's look at the third one. So the task, reassure that although uncomfortable, it is unlikely to lead to complications. Inform that this is likely to recur. So we could use, I can see this must be irritated and sore, but the good news is it is unlikely to get worse. Unfortunately, though, it will probably happen again in the future. How could we use the idiom that talked about in the future in place? Well, here we go. It could probably happen again further down the track. And there we have it, using three idioms. If you need some more practice, maybe as a warm up each day when you're doing your daily practice, you might want to go to the Mayo Clinic website where you can find all of these questions. If you look up blepharitis, questions for the patient to ask their doctor, look at them all. What a great way to do a warmer every day when you do your speaking practice. So check out that website. But also, I want you to just reflect back on the lesson and think all the things that you can now do. You can give an everyday explanation of an eye condition such as blepharitis, use a good questioning technique with your patient, be tactful when you're speaking to your patient, and use an idiomatic expression in a consultation. So you might want to then book some lessons with OET Online. You might need some virtual live classes. The recorded videos from these sessions are available as well. There's 2 classes every day in different time zones, so there'll be one that suits where you are. There's plenty of skill building material for the different parts of the test, for the writing, the reading, the listening. and an oral communication clinic that has some tips and strategies for the speaking. There's personal teacher support. You can do private one-on-one tutorials for any of the skills. So check us out, like Renato and Sarah did. Look at their wonderful results in their OET exam. They've both cleared all parts of the test with a B. And for more information to come and join us at OET Online, you can send us an email or visit our website, oetonline.net.au. So thank you for joining today. It was great to see you all participating, and it's been wonderful having your interaction and your ideas. I hope that you've all learned something along the way and picked up some tips that will help you with your OET exam. So if you have any questions, please, you can ask for, I'll hang around for a few minutes now. Shahzad, you're welcome. So please feel free, if there are any questions, you can maybe send us an email at info@oetonline.net.au if there is anything that you would like to know. And that's all from me today. It was great having you company, and it was great to see all of you joining in. I hope I've been able to help you a little along the way with this. And that's all from me for today. Thank you and goodbye.